Hello and welcome to this instructional video on how to give injectable medicines to control symptoms. You will notice that a small injection line has already been set up for you just beneath the skin. This will allow you to give the prescribed medicine safely without having to give multiple injections yourself. This means that you'll be giving the medicine through the line and not directly into the skin. Please feel free to watch this video through as many times as you need to before you feel comfortable doing the procedure yourself, but also ensure that you contact the Goldline team using the number provided on your leaflet, as they will be able to guide you as to what medicines you should be giving. It's just underneath the skin. In this demonstration, the line is in the patient's arm, but you might find that it is in another part of the body. Wherever it is sited, it will work the same way. It might even look different to this line, but all the cannulas will work the same. It is held in place with a clear dressing that will let you look at the skin underneath to make sure that it is not red or swollen and it is not leaking. Remember, if at any time you are unsure or concerned, please ring Goldline or your district nurse for advice. Before we go any further, we want to ensure that we have all the equipment we need for the procedure. For this procedure, we will be needing an antiseptic wipe, 2 syringes, a pink filter needle, a plastic tube with sterile water, the medication we'll be giving, a sharp spin to dispose of the needles, and a medicines chart. Our first step will be washing our hands with soap and warm water for 30 seconds to a minute, allowing our hands to dry. If you do not have access to warm water and soap, you can use alcohol gel, but make sure it dries thoroughly before you start. Now, we will assemble our syringe. Open the packet containing the syringe and the packet containing the needle. It is important to note that the pink needle is a blunt needle. This means you are less likely to cause injury to yourself, but it should still be handled carefully. Fit the needle as demonstrated. Open the packaging containing the medication and you will see there is a glass vial or ampule with a dot on the neck of its bottle. Here it is a blue dot. With the dot facing towards you, place the thumb of your dominant hand a little above the dot and hold the opposite side tight with your forefinger as demonstrated. Now, snap the neck away from you as shown and put the top straight into the sharp spin. Now remove the cap of the needle on the prepared syringe and draw up the medication according to the instruction sheet. For this, we will be needing 1 milliliter. The syringe is the correct size for this. The vial might contain more medicine than you need. Don't worry about this. You will dispose of any extra afterwards. So carefully pull the medicine up into the syringe and to the correct volume. If you have drawn up too much, put some back into the vial. If it's not enough, you can just put the vial down again and top up the amount. Invert the syringe as shown so that the needle is pointing up and observe for any air bubbles in the syringe. If you see any, give the syringe a little tap until you notice them vanish. Some very small bubbles are fine. Carefully replace the lid onto the needle. Remove it from the syringe and put it down safely. Now, take your antiseptic wipe and open it and clean the rubber bung and let it dry for 30 seconds. Now, we want to attach the syringe to the bung by gently inserting it. You can now slowly push the contents of the syringe into the line. Lastly, we need to flush the line with sterile water. This is important to keep it clear. The sterile water is not a medicine. Its job is to make sure that the medicine in the line has all gone in. For this, we need to fit the needle onto a new syringe, as done before. Draw up 0.5 millilitres of sterile water into the syringe. In the same way as before, push this medicine through the line. And then lastly, we will be disposing of this needle and syringe into the sharps box. And the medication. Do not seal the top of the sharps box until it is full to this line. Make sure you keep it somewhere safe. Recheck the line and skin and make sure that there is no leaking. It is important that we keep a record of how much medicine has been given. To do this, use the charts that you have been provided with and please write down your name, the amount of medicine that has been given, the current date, and the time. You should also write down how many ampules of medicine or vials of medicine you have left, as this will prevent you from running out. Your team will regularly review these medicines to try and minimise any extra injections that they may get. Do not give more than 2 doses of the medicine within a 24-hour period. If you feel that the patient may need more, please contact the Goldline team. Thank you for watching, and we hope you found this useful.